part of the solution, and I'm excited and hopeful that the rest of you will decide to be a part of the solution too. I'm not saying this from an empty pocket. I'm actually an operator of 3 restaurants, a bar, a hotel, some retail stuff, and I'm also a property manager. So I know what I'm talking about as to how this crisis can hurt us in our pocketbooks, but I also understand what the cost of beating this crisis is. So I encourage you all to listen, and listen good, to what the authorities have to say on this subject and how we have to go about fighting this and beating it. With that, I encourage you all to send in your dues to the Chamber of Commerce, or at least join it, because it's a great organization. Thank you for your time. John, I turn it back to you.
Thank you, Mike. We're going to get things started with John Felton, our County Health Officer. And John, I saw from your office just a few clarification messages and a press release go out a few minutes ago. So hopefully you'll cover some of the changes that were just sent as well. So John, it's yours.
All right, thank you. Thank you everyone for being here. So let me start off with just sort of a situation report, if you will. We've been watching and really being concerned about the growing number of cases in Yellowstone County, as well as throughout the state of Montana, particularly over the last 2 weeks. To just kind of put in context what we've seen happen in the first 10 days of August, we had a little under 1,100 cases in the state of Montana, and about 265 in Yellowstone County. In the first 10 days of September, we had a little under 1,300 cases in the state and about 330 in Yellowstone County. In the first 10 days of October, we had 5,244 cases in the state and 881 in Yellowstone County. So we've had an explosion across the state. Montana is right now the 3rd highest state in terms of cases per 100,000. We're only behind North Dakota and South Dakota. It is across the state. Yellowstone County has the most cases. Obviously, we also have the highest population, but the disease has really spun itself out of control. We held a press conference on Monday, October 5th, in which I talked about the need for us as a community and as individuals to do our part to slow the spread of this disease. And trust me, I get that everyone's really tired of this. I can assure you that no one is more tired of COVID-19 than those of us in public health and our healthcare partners. But the virus is not done with us. And so what happens when we get tired is we begin to drop our guard and we become less concerned about following the prevention mechanisms. It's really important to understand there is no definitive treatment for COVID-19. There is no vaccine for COVID-19. What we've got is prevention. And prevention is not very sexy, it's not very exciting, but it really works. And it's all about maintaining distance first and foremost. That is number 1. Wearing a mask when we're out among people outside our household. Limiting our close contact to others. Being very cautious and cognizant of hand hygiene. Maintaining surface cleanliness and sanitation. And staying home when we're sick. It's not very sexy or exciting, but it's what works. So what I said on October 5th was, I set a target for our community. If by the end of October, the week ending October 31st, we had more than 40 cases per 100,000 population, which for Yellowstone County is 452 cases, then we would have to institute some restrictions to slow down the spread. And the reason we went on basically that 4-week period is it takes a little while for steps that we do to stop. What we're seeing now was baked in 7 to 14 days ago. So you can't immediately get the effect. We also set a target which seemed really out of range at that time. At that time, we were just a shade over 30 cases per 100,000. And what we said is, if we go over 50 cases per 100,000 in a week, we couldn't wait till the end of the month, we'd have to do something. That very week, we not only went through 50 cases per 100,000. We went over 60. We blew past that seemingly unlikely mark by more than 20%. We ended up the week ending October 10th with almost 62 cases per 100,000. That is unsustainable. Public health can't keep up with that by any means. We've been very transparent about the fact that we can't keep up. We've hired a ton of people. We hired, in the last 4 months, we've hired about two to 2.5 times as many people in the last 4 months as we typically hire in a year at Riverstone Health. And most of those folks are doing testing and case investigation and contact tracing, but we can't keep up. Our hospitals are holding their own in terms of, they still have capacity where they will take care of people who come to them for care as they should. But we have now set a new mark. We've gone over 100 inpatients in our 2 hospitals. Our 2 hospitals have something in the neighborhood of a little over 500 beds, and today 106 of those are holding COVID-19 patients, including 28 in the ICU and 19 on ventilators. About 40% of those people are from Yellowstone County, and about 60% are from the region. But as we know, Billings is the regional healthcare headquarters. So we expect the regional patients. So basically, we had to follow through with what we said, which was to institute some restrictive measures. What we had talked about early on was going down to a very significant reduction in capacity at restaurants and bars and other places. That would have been at the end of the month had we been able to really give all of us a chance to make the changes we need to make in our own behavior to slow down the spread of the disease. Clearly, we blew through that 50 per 100,000 mark so fast that even if all of us had started doing those things on October 5th when I asked you to do that, we wouldn't have seen the effect yet. So what we ended up issuing was an order that really, it reinforces the importance of bars and restaurants closing down at 12:30 as the governor's order currently requires. That's not new from us. That is the governor's current order. It reminds us that we have capacity limitations in different places of business. Reminds us to follow all the governor's directives. It does institute a limit of a gathering size limit of 25 within the county, and that is what makes that more restrictive is many of the governor's directives have talked about capacity limitations if we can't maintain physical distancing between people. Because of our dramatic increase and the pressure we're under in terms of the onslaught of cases, we made our cap at 25 regardless of the ability to physically distance. Now that's an important thing to talk about here is what is a gathering? If 15 couples go into a restaurant and sit at 15 different tables and have dinner, that's not a gathering of 30 people. That's 15 groups of 2 or 15 small families. When we start talking about gatherings, it's when we come together for a common purpose and we're in the same place. So a party, if 30 of us decide to go to the restaurant and rent the room and the private dining room and have an event there, that's a gathering. And so we were concerned about that. So what we did the other thing we said at that time was we talked about churches and we didn't manage that very well. So let me just tell you what we intended and then what we've done today. A church service is a gathering, clearly. And so what we didn't want to do is limit churches to 25 people. So we said they could exceed that 25 people if they had physical distancing and masking requirements. And it could go to 50%. That caused a lot of confusion because pretty much everyone else under the governor's directive is at 75% of occupancy. So today we did issue an amended order, which really, the only thing it changes from the October 12th order is it does take churches to 75%. So everyone is at the same level. But again, even the things we have to watch out for in these types of, in any places, what really spreads the disease? The disease is spread primarily by droplets, which come out when we talk. So singing expresses more droplets, expresses them farther. Shouting, yelling, dancing, those are where there's close contact, that's what's risk. So we got to really watch that close contact. So we also provide in that October 12th order that carries on in today is some recommendations. We really want people to be very careful about masking and maintaining their distance. And we ask people to limit the density of their interactions, meaning no more than 6 non-household members per week. We ask people to limit the duration of their close contacts to less than 10 minutes so that they won't cross that threshold of requiring people to go into quarantine if there's a case. The other thing we issued today was an FAQ document. You've seen this happen from the governor's office several times, and we think that's a good methodology. We have gotten a lot of questions in the last 2 days, and so we've taken basically the essence of those questions and provided some additional guidance. So there's limited impact on businesses from this order. Really, there's very little, because all it does is continue the current orders. It's really critical that we as a community do this well, because quite honestly, we're running out of options. You know, what comes next after giving us all a chance to do our part? Really what we're talking about is then we do go into more onerous restrictions in terms of capacity, because we have got to slow down the congregation of people. You saw the county commissioners come out and cancel all events at Metra through November 9th, which is the duration of the current order. That really helps. That's a big step to say, you know, we're going to do our part. For all the rest of us, it really is making sure that we're not, you know, we're staying home when we're sick, and we're not compressing ourselves in large groups, and you know, we're wearing our masks and keeping our distance. We are running out of options of ways to slow this thing down. I'm not here to scare anybody. That's not what we're trying to do. The reality is we simply cannot continue to grow cases at the rate we are. Forget about the impact on public health and the healthcare services for the moment, because that is a huge concern to us. But we're going to run out of employees. We're going to run out of workers. Right now, every case is linked to an average of 3.5 to 4 contacts, which means that those 700 cases that we had last week resulted in somewhere between 2,500 and 3,000 people needing to go into quarantine. Those are your employees, those are your school kids, those are our teachers. We have got to slow this thing down. So my deep request is do everything you can. If people are coming into your businesses and aren't maintaining distance, aren't masking, please interact with them. I'm not asking you to get into a big fight. I'm saying let's ask them to please wear their mask. Please keep their distance. If they can't do that, find another way to deliver service. You know, I can tell you, this will be my last comment, we had a situation in our organization, because we do require masking, where an individual came in for service. It wasn't a medical service. It was another service that we provide. And that individual said that he would not wear a mask. We asked him to step out to his car. We sent one of our staff out to address his issue and handle what he needed done from a safe distance with our employee being masked. It can be done. You know, we are all accustomed to no shirt, no shoes, no service. I would ask you to be really strong about no shirt, no shoes, no mask, no service, because I don't really understand why this is a political issue. The virus doesn't care. It doesn't care if you're big or short or fat or skinny or Republican or Democrat or white or black. It doesn't care. So we've got to depoliticize this. The way you stop the virus is those simple measures I talked about. And so that's my plea, is please do everything you can, because we are running out of options to slow this thing down. Thank you, John.
And Mr. Felton, thank you. I've heard from so many of you out there are doing the right thing. You are following the orders and the mandates that John just referenced. But I've heard many of you reach out to us, reach out to the county attorney's office, reach out to John Felton's office, expressing some concern that there are, if you will, those outliers who are not following those regulations. And you know, the question comes up quite frequently is are they being held accountable, and what enforcement tools do we have? I wanted our county attorney, Scott Twito, to address that, if you will, Scott, and then we're going to have Raph Graybill, the governor's office, talk a little bit about some of the new tools he's giving local communities right after Scott. Mr. Twito.
Thank you. Hello, everyone. I'm Scott Twito. I'm the Yellowstone County attorney. we talk a little bit about the enforcement and what we've decided to do, what I've decided to do. Essentially, once a governor's directive came down, it authorized the county attorney to essentially be the enforcer. The rules of law that I can enforce are gathered in Title 50. What it allows me to do potentially is to cite people that violate the directive or John Felton's adopted order. How I would do something like that as your elected prosecutor would be as follows. I would have to have an investigation done by an agency. It should not be done by my office. It would be maybe the Billings Police Department. They would prepare an offense report. We did training with the law enforcement agencies very early on, even before the first directive was brought down, when we knew it was coming, to let them know the statutory authority they had to investigate these cases. We had consults early on with Mr. Felton in his office, because his office is involved in the process to a degree. If I have that investigation, then I have to take it and I have to staff it with one of my prosecutors. That prosecutor then has to review that information. Depending on their determination, if it's probable cause, they believe that a violation occurred, they could file a charge. We, due to COVID, due to jail overcrowding, due to the fact that I don't think the statutory authority allows for jail time, we would give what's called a notice to appear. Because of the restrictions that COVID has placed on the court system, we would give them a notice to appear in a court of what's called limited jurisdiction, which some of you might know as justice court. That's here in the county courthouse. Right now, based on the limitations placed on the justice court throughout this process and the efforts they've taken to be COVID safe, we would probably be looking at 30 to 90 days out before we would get them to appear in court. And then they would have all the due process afforded to them under our constitutions, both Montana and the United States Constitution. We would have to prove the case with factual evidence, essentially that there was a violation, whether that's a curfew violation, an occupancy violation, whatever, employee not wearing a mask violation. So it's a long process, but it's a process that I have to undertake in my prosecutorial duties. So to this point, we chose a different tactic in terms of enforcement. I think it goes along certainly with the governor's directive from July, which referenced the masks and sort of the new normal that we're all trying to adapt to. And so we took an education approach. So if we would get a complaint that would come in about a business or about an individual, something beyond the simple called into the county attorney's office or called into Mr. Felton's department and said, you know, I was driving downtown and nobody was wearing a mask. If there was something substantial and there's some contact information, I have an attorney in my office that spent countless hours returning phone calls, calling those businesses, speaking with the health department, trying to get them to educate them why we need to be in compliance with the governor's directive. We've done that hundreds of times. Our complaints we have a lot of complaints. The vast majority are ones that are difficult to follow up on, but there are some that we have. Pleased to say, based on the resources we've allocated, and those of you on the call, most people have really done their best. They really have. We felt very successful in our conversations with folks when we've had a complaint, and we have not felt the need to file any citations. And quite honestly, I can only begin to imagine the struggles that you guys are all in and all of the pressure on businesses and institutions in our community. And so I have been, quite honestly, very loath to push hard on this authority. I think it would be incredibly taxing on the limited resources that my office has. I'm not sitting here to make excuses, anything of that nature, but the bottom line is in the 25 years that I've been a prosecutor in this community, I've never seen a county attorney's office prosecute a curfew violation. There are other enforceable entities in our state that are equipped to do that. They have administrative procedures to do that. We're not in the business of doing that. Our courts wouldn't be used to that type of thing. I'll just be honest with you, I can barely keep the courts going forward, which causes a whole new problem. Our judges have been great to deal with. We, like John has said, and many of you have probably experienced, we have had courts down for a period of time or limited interaction with court because of COVID-related issues. We have, with Mr. Felton's new order, I have to keep the criminal justice system moving. We just finished up a criminal trial yesterday. We've got another one starting Friday, but now because we've got to avoid the 25 person gathering, we can't have our normal impaneled jurors come forward. So we're trying to work a system out where we're going to have jurors come in batches. That puts further stress on all of our courts and their limited time. So it's been incredibly difficult and challenging. And so obviously I recognize a lot of the people on this call today. Many of you have reached out to me. We will continue to work hard to educate people when we get complaints at this point, but I don't see moving forward writing a lot of, or following up, I should say following up on a lot of citations. I don't know, I'm not going to speak for Chief St. John or Sheriff Linder, who are the two primary local leaders of law enforcement in our community. But I will remind all of you, something that John brought up. If you're running a business and you have a patron coming in that is not wearing a mask and they refuse to comply with putting on a mask, which is required under the directive, we tried to take that off of you. That both the chief and the sheriff said you can immediately call them and they will send someone down to deal with that person and issue a trespassing violation to make sure you're in compliance. Other than that, we're here to try to help you as best we can. We are available as much as possible and certainly willing to talk to you about the steps that we've taken thus far. So thank you.
Thank you, Mr. Twito. I think as many of you know, there's three entities that are able to enforce and look at the regulations in terms of holding accountable those businesses that you guys are calling us about that are struggling following the rules. And those entities are our county attorney, our county health officer in the state of Montana through the Department of Revenue, liquor licensing, gaming licensing. And yesterday, the governor announced that he's going to provide additional tools. As Mr. Twito just said, the lack of resources are a big challenge between our county health officer and our county attorney. And yesterday, the governor announced that he is providing extra tools to help mitigate those concerns. So we've invited Raph Graybill, who is the chief counsel for Governor Bullock, to kind of define a little bit what those tools are and let us know how we might be able to take advantage of that. Raph.
Thank you, John, and thank you, Scott, for your comments as well. Scott and I had a really good, productive conversation earlier today on the existing challenges the county attorney's offices are facing across Montana and how we can help try to empower county attorneys to join public health in this process to help provide some additional support where it's needed. I'll briefly, I'll try to be brief given our time, tell you a little bit about some of the resources the governor's announced and some of the additional tools. As Scott described, the criminal process to enforce public health directives is pretty cumbersome. It comes with a fairly modest fine, $200. It's a really long process. I have not heard from any county attorney in the state that they're using criminal sanctions as an effective way to deter businesses from flouting the mandates and from having these congregations of people that result in the spread of the disease. Where we have seen more success is in communities that are following a civil approach. And the way that process works in the initial stage is not that different than what Scott described. Basically, you get a complaint. Most of these complaints are unsubstantiated, I saw someone in Shields not wearing a mask, typically that's, not going to result in a whole lot of state resources being devoted. But where you get repeat complaints about a certain business that is an egregious bad actor that really does not follow the rules repeatedly, first you send out someone from the health department and you conduct some education. That could also be outreach from the county attorney's office, though resource reasons might prevent that. In other counties, they often then do a written education notice, which is kind of an intermediate step. And then Montana's public health laws authorize the public health officer to do a compliance order, to say essentially, this is a legally binding order, you must come into compliance. And, by this point, the vast majority of violations get taken care of because by and large businesses want to do the right thing. For that very, very small portion of businesses for whom a compliance order from the health officer is not enough, other counties have pursued a civil remedy where they essentially go to court, they enforce the order, they essentially sue the business to get a temporary restraining order, and then that business can't operate until they go back into compliance. And that's something that can happen very quickly. There is due process, there is a review by a court, but it doesn't get wrapped up in this 90-day process that the criminal sanction gets involved in. And we've seen that work in the very, very small number of cases where it reaches that point. That has worked relatively well in Butte-Silver County, Lewis and Clark County here in Helena, and in Missoula. And so Scott and I had a good conversation about that today. There are other tools, and again, very few cases reach that point. What the governor announced yesterday is that we've made a determination in our office that we can use CARES Act dollars to reimburse county activities to help with enforcement, either on the reactive side, which is more of Scott's department's county attorney's office, which will be those very slim slice of cases, or ideally on the proactive side, trying to help John out with getting some more resources to go out and follow up on complaints, or if need be, help build the investigative record that Scott would need to follow through on a civil case. And we completely understand the resource constraints now dealing with the normal criminal docket in Billings. Don't want to put more on people's plates, but the governor wanted to announce we have resources. It will be a community decision, especially between John and Scott about sort of what specifically you need. But when there is a resolution around, we need to hire 15 temporary folks to come on and follow up on complaints, or we need to hire DOJ liquor inspectors on contract to do this work. Whatever the solution is, we want to say, we're here, we want to be partners. We have a vast amount of resources we can put towards this, and we really want to help the community where it's needed the most. Just want to emphasize again, really good productive conversation with Scott earlier today. We are here to help, we're here to offer resources. Any civil process, just like a criminal process, has to be fair, has to be objective. The goal is not to embarrass certain businesses, but it's to make sure that where there are truly bad actors that do not follow these orders, there is some consequence in the legal system, and that exists, and there's resources to follow through on that. So we're here to provide that. We want to support a fair process. But as the governor said yesterday in his press conference, this is the issue facing Montana right now. There is nothing more imminent and severe than COVID-19, and where we can be good partners and help you, we are happy to do that, and we stand ready for your requests and want to assist. And I'm glad that Scott and I have been talking, and John, I know you're in touch as well with our public health folks as well. So I'll leave it there.
Mr. Graybill, thank you. And we'll spend some time later today and over the next day or so visiting with Mr. Felton and Mr. Twito about how we can take advantage of those opportunities the governor's now given to us in terms of funding that's available and other resources. So thank you for that. Again, everybody on the call, our goal today is to really make sure that you're not all being drugged down by the lowest common denominator, that we're all rising to the occasion, so that when all of this is done and we're able to get back to 100% operation, that you're still out there. I mean, you define the character of our community with the uniqueness that you offer, and to be able to provide that Custer's Last Stout and that Captain Crunch waffle or that Black Sabbath burger is something that's important to us when all this is said and done. So, one of your leaders is on the call with us right now, Brad Griffin, the Executive Director of the Montana Restaurant Association. And Brad, I wanted you to offer a couple of comments as well, if you would. You're on mute there, Brad. There you go.
Sorry about that. Thanks, John. Appreciate the opportunity to be here with everybody today. My comments are going to be very brief. I do want to say directly to John Felton, thank you for hearing our concerns last week. Those concerns were that being reduced to a 25% capacity would result in insolvency for every bar and restaurant in Yellowstone County. I stand by that statement. So we appreciate that John Felton heard that. He also heard even reducing to 50% is going to be very problematic from a profitability standpoint. So John Felton, thank you for hearing our concerns. I think that what you did come out with will ultimately make a difference. And I understand you've got limited tools in your toolbox here to work with. So I'm pleased to hear the conversation today about all the different agencies, what we can do for enforcement of the existing orders rather than implementing new orders. We don't want to operate with the lowest common denominator, because I do believe that 95%, perhaps even higher, of business owners are trying to do the right thing. I certainly see that as I go out and about in the community every day. I think we need to focus on those who are willfully disregarding the rules and hold them to account. So whatever method it takes to do that, whether it's through Department of Revenue, I personally believe they have the ultimate power here because they control liquor licenses. But if it's a coordination between the Public Health Department and Revenue, whatever method that takes to hold people accountable, I think that's what we need to do. So again, appreciate being invited to the discussion today, and we'll look forward to being part of the solution going forward.
Brad, thank you. We all appreciate those comments very much. We're going to go to Q&A here in just a minute, but I wanted to first introduce everybody to Dr. Holzman. Dr. Holzman is our state health officer, kind of John Felton's role on the statewide level. So Mr. Holzman, or Dr. Holzman, please.
Sure, thank you. I don't want to add too much more. I guess the side that I'm going to plead on and taking off from where John went is, and be happy to answer some of these questions if it's helpful, but really public health can only be solved at the public level. So it really, while we're a very individualist society and Montana even more so, this is something that has to happen all together. And any ways that we can assist on that is really important. I think a couple informations that we could get across, and like I said, I'd be happy to talk about some of the miscommunication that's out there. What we've seen in general, a lot of times it's younger people that first get it, then we see older, then we see hospitalizations, and then we see deaths. We've seen quite a few of the hospitalizations and deaths going up in our hospital systems. Not across the state as of yet, but it's been increasing all along. Billings areas, as you know, has their hospitals are stressed right now, and we haven't even hit flu season yet. And I can tell you that it's gone over into some of the other regions like Cascade County and Flathead. And one thing that I hear a lot about is, well, let's try to just protect those that are vulnerable. And there's no doubt that I can't tell you how any individual person is going to respond to getting COVID. Many young people get it and don't have very many problems that we know of. Long-term consequences, you know, we're still learning about, but many look like they do very well, but some don't. We do know if you have an underlying condition, your risk goes up quite a bit, and they're elderly, you go up quite a bit. But I don't think people sometimes realize that 60% of the United States has an underlying chronic condition. 4 out of 10 of us have 2 or more. And many of us have chronic conditions, we don't even know about it. A number of people that have high blood pressure that don't know about it, or don't consider themselves obese, but they probably would be by a BMI. So those aspects play it. And then, so it's hard to make a protection that way. The other reason that's, you can't say, well, I'm just going to make the nursing homes do everything possible to keep a cocoon around that, is kind of the storming the fort analogy. One or two individuals, if the cases are low, we can address it and try to prevent it from getting in. But if the numbers are super high, those people are going back and forth, the risk that it's going to get into these high risk institutions like assisted livings, senior livings, group homes, prisons, other places go up dramatically. So we know there's a lot of simple ways that we can decrease the risk. The nice thing about viruses is they can't replicate outside of the body, so they just need to get to another person. And if we can break that, we can make a big difference. And the more people understand that, it's just a matter of, I'm wearing the mask not for me, I'm wearing a mask to protect others, not for me per se, is just the simple aspect. It's just, can we just do these things within our businesses to help our fellow person and keep the virus down? So not only businesses can keep open, I know that's really important to you all and important to me too, but we decrease the spread and we decrease the risk for everybody in the community. So thanks what you are doing, and if there's ways we can help, let us know.
Thank you, Dr. Holzman. I'm going to jump over to close things out to see if Mayor Cole has any final comments before we open it for Q&A. Mayor? You're on mute. Thank you.
That's one of the few problems I can fix. Thanks, everybody. On behalf of the community, since I do wear that hat, I don't think we can say thank you enough. And so thank you. Thank you to John Felton, to his staff, our healthcare community. Can't imagine what it's been like to be in the trenches for quite this long, and also not to see a clear light at the end of the tunnel. We are in this for the long haul. I think that's clear. And so anything we can do to support them, we need to do. But it's not just thanks to our healthcare workers and public health and John, but also to our chamber, to our business community, who are also and have been in those trenches. They're just it's a different trench, but it's still a trench, and there's not easy light on the horizon there. So thank you for your patience. Thank you for working hard. The chamber for the work from home pledge, organizing this meeting, organizing other meetings. This is an opportunity for our leaders to step forward, and I think as a community we're doing a good job. It's kind of the best we can under a difficult situation. To get through this is going to require teamwork, patience, and a lot of concern for others. It's that last one that I think is particularly important. You heard Dr. Holzman. This is an unusual situation where there's a disconnect between our actions and the consequence. Often our actions bring consequences for us. In this case, our actions have consequences for others. And that's where it's particularly difficult. A lot of the driver in this has become young people under 40. But it's a problem, when my bad behavior has consequences for the rest of us. So we just have to remember that. It's just, as again, Dr. Holzman said, it's not possible for people to lock themselves up in a cocoon. If it were, the people in our nursing homes who are literally locked up would be safe. But the reality is they are some of the most at risk. I have a brother, 69 years old, in a memory care facility in Bozeman, who recently tested positive for COVID. I'll assure you, he has not stepped outside the locked door for 4.5 months. But some person, staff member, brought it into the facility. Fortunately, he's doing well, but that's impacted now almost 50% of the residents as well as staff members there. So encourage you to do what you need to do and what we've been saying, masks, social distance, all the things that you've got memorized. But obviously that's not working, or at least it's not working as well as we'd like it to do. So we've got to do something different. So just 3 or 4 things that I've jotted down. One is, and I'm largely just stealing from what's already been said, but one is communication. Being more assertive in a gentle but firm way with others, that means our employees, that means our family, that means our friends, our social connections, our customers. In the case of businesses, posting a greeter who gently says, "Oh, you don't have a mask. Well, let me give you one." Makes all the difference in the world. But it comes with a cost. Obviously, I mean, an actual cost, but it's something that I think that we have to do. Second, the issue of enforcement. I really appreciate Scott Twito's presence on the call. He made it very clear that the criminal prosecution option here is not a good one by any means. And so we have to go down, I think, a more assertive civil enforcement. And that means those informal contacts in person, followed by a more formal letter, all of which is being done, but we somehow need to step that up. And then moving on to a healthcare order of order and compliance. And it wasn't mentioned, but my understanding is a potential closure order. The healthcare officer could issue closure order and then potentially civil injunction. All that's going to take resources. And so we need to look about how we can access those CARES Act dollars. Is it even possible to hire more sanitarians? I don't know. These are all way above my pay grade that our experts and county health officials are going to have to weigh in on. But it does seem like we've got some options there, but we're going to have to work hard to make them happen. And keep open to inspections. Largely the system is complaint driven now. In Missoula, they are starting to do a broader based inspection system. That's harder in some ways, but it also takes some of the pain of it being a complaint system, which always leaves you open that it's just your competitor issuing the complaint instead of it just being part of the random inspection process. And then the last thing, we haven't talked about it here, is better contact, faster contact tracing. John Felton, again, is the expert here, but my understanding is they're so taxed that there's a long, multiple day delay on getting that contact tracing done. And I think we need to talk with John about how we can help with that in getting more resources, finding other organizations in the community under the auspices or under the ultimate direction of the healthcare under Riverstone and John Felton to speed up that process. So again, thanks everybody. It's a long haul, but I think I see a little bit of light on the horizon there. So all is not dark and doom and gloom. We're going to get through this one way or another.
Thank you, Mayor.
Thanks, John.
Thank you. We're going to open up for Q&A right now. And if you've got the ability to digitally raise your hand, please do so and we'll call on you. If not, just ask your question and we'll try to do so in an orderly fashion. So while you're thinking of your questions, Rafe, real quick, can you please address maybe some of the parameters around how we can access some of the CARES dollars for the enforcement?
Yeah, so it's basically make the request to us. Contact me, contact the budget director. I can provide information to anyone that needs that. We are ready to move quickly. There's a substantial amount of resources. The easiest way for us to reimburse costs is if the city or county or some government entity makes the reimbursement request, but work with us to build a plan. We are fairly flexible. This is it's a cost directly attributable to COVID-19. This is exactly what the CARES Act is for. So to the extent John, Scott, others develop a plan that requires additional resources, we are happy to lift those constraints and be there to help. So and I also want to say as well, this idea of providing CARES Act dollars flows directly from conversations with the Billings Chamber and from John. So I really want to commend the business community and John for stepping up here and putting this idea on the table. We are ready to move quickly on it and eager to work with you.
Great, thank you. Thank you for all your help. I don't see any digital hands being raised. So if somebody has a question, there we go. Mitch Lagge.
Hi there, this is Mitch Lagge. I'm a reporter with Q2 News here in Billings. Probably a question either for Mr. Graybill or Mr. Twito. Scott, you mentioned that I guess I guess your first predilection of the law was that everything had to go through the criminal process. What I'm understanding now is that the Yellowstone County legal system is now going to be taking a civil process through these COVID-19 violations. Could you kind of explain what that means for a layperson, I guess?
Well, Mitch, if I understand your question, I was explaining to the participants in the call the criminal process, because the chapter entitled 50, which authorizes all this, does contemplate that. It also contemplates a civil component, but the similarity that they have, and Mr. Graybill sort of discussed this a little bit, is either way you go, you have to have sufficient investigation, whether you're trying to enjoin the group civilly or you're going to do a criminal complaint against some repeat offender. We've got to have an investigation, something that's going to withstand whatever scrutiny the court's going to put on it, something that's substantial. One of the difficulties, and I think Mr. Felton identified this, and Raph just mentioned this, I don't know how John's folks have done it, because, I don't know how many of you guys know this, but we've had to, well, you that have kids in the school districts know this, we've had to cross-deputize contact tracers through the school district. Your principal, a dean, somebody is a contact tracer. I know it's been incredibly difficult to try to hire folks, and I know John has gone to great lengths to get folks. But what I'm contemplating, if you went on the civil side of things, even if you went down that road, you'd need investigators. Under John and his group, you would need investigators to look at what's going on. It's not enough for an individual to call my office and say, this bar was out past 12:30. I think someone told me that this happened last Saturday. That's just not sufficient, other than to start the process. But I or John or law enforcement of some branch would have to send an investigator to do follow-up on that. They would have to get, a little bit more to go forward. And so I know my courts very well. I've practiced in front of all of my judges, and they're going to require a lot if they're being asked to issue an order to enjoin a business here in town. And they're going to want a heck of a lot. The enjoyment process has been done in Missoula. It has been done in Lewis and Clark County, and it has been done in Butte, Silverbow. Mr. Graybill is correct on that, but it has been used like a minuscule amount. I think I can speak directly about what Lewis and Clark County has done, because my attorneys speak with the Lewis and Clark County attorneys, and we discuss successes and failures in terms of education and everything else. I think they've done 2 or 3 total, and with measuring degrees of success. So I guess, I'm willing to talk with Mr. Felton and explore gathering some of these resources to help go after some of these bad actors. It's totally acceptable to me. It just has to be done in a fashion that's appropriate. I can't just subjectively decide who to go after. Every complaint that I get, you have to have a mechanism in place for applying it fairly to everyone. And that is something that takes a lot of resources. We're talking about thousands of complaints in Yellowstone County, thousands. And so I know John doesn't have the resources. He's barely holding on as it is. I don't have the resources. I don't think the Billings Police Department has the resources, and the Sheriff's Office doesn't have the resources. So if we can get those resources with these dollars, great. I am absolutely willing to continue a conversation with the Governor's Office to try to get these resources.
Thank you, Scott.
Yep.
Yep. So Raph Graybill, do you have any thoughts to add to that, or did that cover it?
Yeah, I just say real briefly on the civil versus criminal. I mean, take yourself out of the COVID context and think about, normal times, eons ago. Think about a restaurant that is getting people sick on food poisoning, right? Classic public health problem. The vast majority of those restaurants, if you just call them up and say, folks are getting sick, they're going to fix it, right? That's the vast majority. A very small number will have to actually have an official talking to or a health order, right? And a very minuscule number, you might go further. And one way you could go further under the law is you could say, we're going to criminally prosecute you as if you stole a car, right? But the more common route, if a restaurant's getting folks sick and does not comply, is you take them to court under a civil proceeding. You'd say, court, I would ask you to issue an order that shuts this business down until they're able to, sanitize appropriately, clean, basically come back into compliance. And I think, I don't think anyone in this call has advocated for going the criminal route and saying you're a criminal because you don't follow these orders. I think what folks are saying is it will be resource intensive. There's a lot of complaints, and so you have to sort of filter through getting from that wide cone to the narrow part of the cone. But when you get down there to those few, and as Scott mentioned, Lewis and Clark County, they've only done this 2-3 times, right? And because most businesses get taken care of here or here, you get down to this point, civil makes a lot more sense. It's faster, it's less resources, and it's just how we do these things in public health if you get to that point.
Thank you. We've got a couple of hand raised here. Let's go to Linda Bate, please.
Hi there. I just really wanted to thank you, all of you, for putting this together and giving us a chance to express our concerns and hear your side of the story. I think this is a restaurant bar group primarily that we're all here. Okay. And I know personally I have felt a little singled out not as an individual, but as a group, because everything seems targeted at what restaurants and bars can or cannot do. So I just like a little clarity on what's happening with other businesses, Home Depots, grocery stores, etc.
Thank you.
That's all. Thank you.
Mr. Felton, would you like to answer that? And there's also a question from Tyler who asked about schools and sporting events and what's the reason that they aren't being discussed. Maybe you can address those together, John.
Okay, you might have to remind me of the other one. My brain is getting old, I think. The governor's directives do differentiate bars and restaurants from other types of facilities. If you go to it's not a matter of singling out that type of facility. It's a matter of where does the data tell us that spread happens. And if you look at CDC, they frequently talk about issues related to bars and restaurants because people congregate for an extended period of time. There are things that happen in bars and restaurants that are really related to what you do for a living, right? So when people become intoxicated and become even a little bit intoxicated, they become disinhibited. They speak louder. They get closer. That sort of bubble gets smaller. They sing, they dance. All those things really enhance the likelihood of spread of a droplet transmitted disease. And so when you look at CDC guidance, it very frequently talks about in areas of high transmission, closing bars and restaurants as a likely source of transmission. So in terms of the other types of places, every complaint that we get, we do pass on to the county attorney's office. The county attorney's office gets them directly, whether it is a restaurant or a bar or a retailer. We've gotten calls about crowds at parks that exceed governor's directives. So it really isn't a matter of we don't like bars and restaurants. I mean, we miss them as much as anybody else. It really is though that as one of your fellows said fellow operators said a long time ago in one of our early economic recovery meetings, my business model is to put a lot of people together and have them stay close together for a long time. So that's really why bars and restaurants get a lot of attention. With respect to schools, if you go all the way back to the governor's original reopening order, he makes very clear that local districts, meaning school boards and superintendents, can make their own decisions regarding how they go back. The reality is, and the reason this was so important is, think about a place like West High or Skyview or senior or middle schools, as soon as you open the door, you violate the governor's order for not congregating more than 50 people if physical distancing cannot be maintained. So in recognition of that, unless you have a school, some of our very, very small schools in the state where they really do have less than 50 people in the building, you pretty much automatically violate that. So the governor did say in an early order that local districts can make the decisions to how, if and when and how they reopen. As school was approaching, and this, I'm going to just throw in a little parenthetical thing here. I think one thing you have to remember is there is nobody alive who has managed a pandemic. There may be people who are alive back in 1918 to 1920, but they certainly weren't managing the pandemic. So everything we do in COVID-19, we do for the first time. So, you know, the governor, we had our first case in state March 13th, which was a Friday. The governor closed the schools on March 15th, that Sunday. So when we started school in the fall, it was the first time we did school in COVID-19. So when we started athletics in the fall, it's the first time we did school athletics with COVID-19. So it's all the first time stuff. So as school was approaching and the question of athletics came up, several of us in the local public health areas asked the governor, when you said that school districts could make their own decisions with respect to what they do, was that only for academics? In other words, only for the classroom and violating the rules there? Or does it also include the activities, the things that go into school, band and choir and concerts and sports and all stuff? And so he did issue a clarification that the local district has authority with respect to not only academics, but also extracurriculars. So they have kind of a carve out. Now I do meet every week with all the superintendents in the county, virtually like this, and every other week with the athletic and activities directors. So we keep a close eye on that. But there is the governor has carved out those local districts for those reasons.
Thank you, John. And Linda and Tyler, thank you for those questions. We'll turn next to Mari Hall. I see your hand is up, and please others just jump in. Mari?
Thanks, John. Yeah, I had a question for, and of course my computer is freezing on me. Okay, I had a quick question for John Felton and Scott Twito. I know Rafe had said that sort of the decision as to what these resources will look like from the state, have those conversations started at all? I mean, is there any idea of what you guys would like to use in terms of those resources to help with enforcement? And then I have another question right after that, but I'll leave it at that one for now.
Well, one thing I'm good at is listening very closely, and Rafe said there were vast resources. So yes, the conversations have started and we need to get some resources. No, quite honestly, John and I need to talk about what would work best for our community. I'm happy to have that conversation with him. And I just want to let you know, I obviously have a lawyer dedicated full-time to his outfit. You know, enforcement, certainly in terms of investigations, in terms of getting the information that we need that's appropriate so we can take an action, whether we decide to go civilly or we decide some other course of action. We need information. And I think maybe on the side of investigation would be very helpful. And perhaps it can come through the purview of John's office, but we have not put pen to paper yet and decided that.
Mari?
Okay, yeah, sorry. My other question, I didn't know if John Felton wanted to say anything on that, but I had another question. I was curious about because I've heard Gina Lervick talk about this issue in the past, and it sounded like that there have been some businesses that have been taken to court for non-compliance. And so I was curious about if you have an idea of how many in Billings or in the county have faced that?
Yeah, Gina would have never said that. We haven't taken anybody to court for non-compliance at this point.
Okay, maybe I misheard her. Okay, just wanted to be sure that I'd ask. Thank you.
Dr. Holzman, I see you have a comment regarding Linda's earlier question.
Yeah, if I could just say a couple things on that, and I appreciate her comments. I will say that I hear from all different groups. They all, a lot of them feel like, you know, we're focusing on them. And that's really not the concept that we're trying to get across. I think what we do have to have different guidelines for different areas because the situations are different. But I do think there are some simplistic things to think about. And if we could keep those simplistic things in mind, we would make some huge differences overall in our community. And basically, it's again going back to what this virus is going to do. It wants a crowded situation. It needs to get from one person to the other. And so if we can break that up in different ways through the physical distancing and seeing how that might work best in a school or in a bar or in a restaurant. Obviously, there's some unique circumstances in both a bar and a restaurant because you have to eat and drink, and that involves removing a mask at certain times. But ways that you could bring that down, and also the distance between people. And then I think the two other things that come into these areas is a good cleaning plan of highly touched surfaces to decrease that risk. And I think we're learning a little bit more about aerosolization of the virus. And so that aspect of how air is flowing through your establishment, there's certain things that you can do, even as far as keeping a window open. I know that's opportunity will soon fade here in Montana, but these different things that allow to decrease the risk of it spreading from one person to the other. Those are some of the really big aspects that I think we can do, and not looking on the punitive side, but looking on the positive side of trying to go forward. Having someone or talking through what you could do within your own business to keep your risks down is really a first step. And just understanding it, because there are a lot of times people just don't, they think of that they're doing the things by the guidance, and that's real important, but there's some just simple aspects of the virus and thinking about how can I break this transmission, and somebody can look into your business and give you some really good ideas of where you can decrease that risk considerably. Thanks.
You know, John Brewer, I have a comment that relates back to Linda's question. I can tell you, as your county attorney, having to look at all these complaints that would get filed, you guys as the restaurant owners and business owners have done a damn good job being in compliance with the governor's directive. The vast majority of you have done wonderful. The complaints that we get, they're very few and far between dealing with your industry. So thank you. Keep up your good work. I know it's a great sacrifice. So I'm just telling you, the complaints are not that much against you guys, and it's usually silly. So you guys are doing a hell of a good job in my estimation. So, for what it's worth.
Other questions? Mr. Graves, do you have anything? Brad Anderson, Brad Griffin? Yeah, Sean, go ahead.
Oh, there we go. All right, sorry about that. I was having trouble with my mic. Yeah, I just wanted to thank Felton real fast for working with us last week. I appreciate taking the time to listen to our comments and our concerns. And I can't thank you enough for actually taking the time to listen to us, help educate us, and help guide us through this tough time. I just wanted to say real fast to the other restaurant and bar owners out there that we've been granted a little bit of a stay of execution. That's how I kind of look at what happened last week, that we're able to operate under the same guidelines that we currently have been under. But now it's time for us to really make sure that we take this seriously. We do not want to go backwards, but it's not going to take one of us. It's all of us together. We have to do this together. We have to follow the guidelines. We have to clean better. We have to make sure our customers are wearing masks, our staff wearing masks. We're all in this together, and a couple bad apples, as they say, or bad actors going around. We have to improve on that, because a couple people can't affect how many people work in restaurants and bars in Montana. 12% of our total workforce in Montana is employed by the bar and restaurant industry, and we can't lose those jobs. We've lost out on the grants. We don't have any more of that coming in. We don't have any PPP loans coming our way. We don't have any federal aid for our employees. So it's a reality check for us that we really got to pull this together, and we got to be the leaders of Montana. We're the largest community in the state. We have to show the other restaurants and bars around the state of Montana that we can do this, we can get this under control, and we have to work together. So I just wanted to thank everybody, the chamber, and everybody helping us out and listening to our voices so we can keep going.
Thank you, Sean. Appreciate those comments. I see we've got a question from Tyler.
Yes. So I was just wanting to clarify a little bit. So phase 2 started June 1st, and that's so restaurants and bars were in phase 2, June, July, August, September. And I hadn't heard any mention that things were getting out of control at that point with COVID until, like I had mentioned earlier, then school started, you know, and so obviously you're having more gathering of people. And it was my understanding there was an increase in cases after that, which would be understandable. And then sporting events have started, and now we're getting more cases. So it feels like they're going back to restaurants and bars, that they're the problem, when it was, is my understanding, fairly stable. Doesn't mean that people shouldn't be doing the right thing, which we certainly have been doing the whole time. You know, you want to be sanitary and wear masks and be safe. So I guess I'm a little confused at why it's kind of going back to restaurants and bars when other things have changed in this scenario.
Thank you for clarifying that, Tyler. John Felton, would you like to answer?
Yeah, so a lot of things have changed. One of the things that's really important in this and that we do is when we have a new case, and in COVID terms, a case is someone who is tested positive, and a contact is someone who is been exposed by a person who's tested positive. Let's talk about the case. We interview, there's a very comprehensive interview that happens with newly diagnosed cases. And it really has two basic functions. One is to determine, can we figure out where the person most likely got exposed, where they most likely got sick. Now, this is a respiratory virus, so you can't say with absolute certainty. It's not like, you know, if you think about, if I'm a nurse and I'm drawing blood on a patient who has hepatitis C, and I know that I don't have hepatitis C, and I jab myself, I have a needle stick injury, and I get hepatitis C after that, then it's pretty clear that I got it from that needle stick. That type of transmission is really clear. With the respiratory virus, it's much more difficult to say with certainty. But we try to figure that out. That's the case investigation piece. So what we know is that about half the time, people have been exposed by someone either in their household or someone else who is a known positive case, a coworker or something like that, where my coworker is positive, I was a close contact, and 6 days later I get sick. That's about half the time. About half the time there's not a clear source of infection. So then you go into a really comprehensive interview process where you ask people, where did you go in the last 2 weeks? And it's not just that, but it gets very specific. Did you go to a restaurant? Did you go to a bar? Did you go to school? Did you go to school? Did you go to church? Did you go shopping? Did you go grocery shopping? If so, any of those, where? And what we found, the increase in cases actually goes back to about the 3rd week of June. If you look at the state map and you expand the daily cases, the increase started about the 3rd week of June. Now, it started very slowly for a while, and by the way, that's 3 weeks after phase 2. So we knew that we just started getting more cases. It's accelerated clearly in the last few months, and particularly the last several weeks. What we're finding in those calls, though, early on when we asked those questions, we'd find out people went to I went to one grocery store, I went to one retail outlet, I went to one restaurant. What we're finding is as people get more and more tired of dealing with this disease, they're going to lots of restaurants and lots of shopping and lots of stores and lots of bars. And so there's many more opportunities for interaction. And I think I understand this sense of, are we being picked on? You know, we left all of the occupancies where they are. We didn't address any occupancies. But we do know that where people congregate closely is the highest risk. And so, yes, we're seeing more, but we're seeing people get tired of the perception that they can't have their normal life back. All of us want our life back. When we get tired of feeling put down, we stop doing those things. So we see less mask wearing, we see less distancing, we see more people congregating, lots and lots of household parties, lots and lots of neighborhood parties. If you look at the restrictions that we put in place on October 12th, the only restriction that really changed things, we dealt with the churches, but is the group size. You know, so we haven't touched the opportunity for people to go places. If we can't slow this thing down, and this is a bar and restaurant call, but I said the same thing a couple days ago to everyone else who was on the call. All of us need to do this. This is about all of us. You represent a place that a lot of people go to, and they go frequently. We like to eat out. We like to go out and have a good time. The more people congregate without being reminded, you got to keep your distance. You got to not be in large groups. You got to wear your mask if you're not eating and drinking. The higher the risk is. You just happen to be a place where a lot of people go, which puts you on the front lines. So honestly, it is not a matter of picking on you. It's a matter of, this is what people tell us, right? Now, and when you talk about schools, yes, schools did open. We actually have a whole process that is much more aggressive in tracking down school cases. As Scott mentioned, we have deputized school workers to help us with that. We are not seeing large groups of large outbreaks tied to schools. We have been steadily between about 10 and 15%, 10 to 18% of new cases per week are in people who are aged 0 to 19, which is obviously the school population. We're not seeing a big change in the proportion of cases that are tied to schools. So, we have experience of other places that are farther down the path and have been through the large increases of cases, and we have what our data tell us, and that's what we're trying to do. If every store, every place that people go, if it just became not a political statement, but the fact that we care about the people around us and we want our community to be safe and we want economic vitality, if all of us did that, we would slow this thing down dramatically. That's what's happening in Europe. The places that go to Europe, in Europe that have seen impressive reductions is because it's just what we do. Is it fun? No. Asia is the same way. We've seen a lot of significant reductions in those areas because people just follow these things. We need to decide we care enough as a community about the people around us and the businesses around us and the schools around us to do this stuff.
Thank you, John. I see Colin Higgins has his hand up. Colin? Colin, are you still there? All right, well, if he comes back on, there you go.
Hey, gosh, I apologize. I had two unmute buttons there. Forgive my, I'm a lowly restaurant guy, so technology is not my strong suit there. Hey, I just wanted to thank you, proud member of the Billings Chamber, as well as the Butte, Montana Chamber, and we also have a location in Rapid City and also in Idaho Falls. So thank you very much for putting this on. I think it's very informative. I guess the one thing I just wanted to convey, besides thanks for everybody for being on this. I mean, again, great information, but yeah, it's been exceedingly hard over these last 7-8 months. And, you know, we've got 235, 240 employees between our 5 locations as McKenzie River franchise operator and owner. And, you know, very, very proud of our staff, you know, for what they've done. And you know, on our behalf, what we've been doing is just preaching, stay the course, keep your head down, you know, knock out your daily sanitation checklist, which we're doing 4, 5, 6 times a day, you know, and just as often as we can, masking up, and daily employee questionnaires asking about your, you know, have you been around anybody that's been, you know, potentially engaged with COVID, or has any of the following symptoms: sore throat, you know, fever, headache, so on and so forth. You know, but just really the daily message has been, you know, stay the course, keep your head down, mask up, do it. Let's just keep at it, you know, and consistency is key. You know, I've got one employee, you know, I won't get on my pulpit or anything, but I got one great manager, actually, who's on the call right now, and he and his wife have a lovely boy that has, you know, CP, cerebral palsy, and you know, I mean, that's a daily threat, you know, and man, I'll tell you, watching him and, you know, as well as my other managers and staff come in and do their due diligence and take care of the rest of the staff and take care of the customers, it's been really humbling, you know, and so just very thankful that we're, number one, open, and number two, that you know, we're allowed to have these forums to learn and, you know, ask questions, and hopefully share some things that are working. You know, and I've often called a lot of our managers self-deputized contact tracers. We've been very fortunate that we haven't had very many close calls, you know, or cases with, you know, COVID, either A, somebody that has contracted it that works for us at our 5 locations, or B, somebody that's been in close contact. So we've been very fortunate there, but, you know, just again, very proud of our managers and our company, Glacier Restaurant Group, our parent company, for doing their due diligence, you know, and just helping stem the tide here. So, and again, yeah, Billings Chamber, thank you for putting this on. I'm going to highly recommend, as a member of the Butte Chamber, that we do the same thing here. So thank you.
Hey, John, this is John Felton. Can I answer the question in the chat box?
Yes.
Also, maybe want to jump in as well. It's from Cameron at Starbucks, and the question really is about time. When we look at the definition of a close contact, so these are the people that get put in quarantine. There's 3 elements of that definition. One is distance, so within 6 feet or less. Second is time, for 15 consecutive minutes or more. And the third is when, and that's during the period the person is infectious, which starts 2 days before the symptom onset. So if a person has close contact with a known positive case, my camera on here, then they will get placed into quarantine. I think, Cameron, you absolutely, if people only sat there for 10 minutes, none of them would be close contacts. I think that is difficult in an environment where we know that people like to sit with their friends and chit chat. I think the bigger issue that we should really pay attention to is really, as individuals, making an effort to decrease the density of our interactions. And again, that's the idea of don't spend time with more than 6 non-household contacts per week. When you have someone if you can imagine a scenario where someone becomes symptomatic, if they went to a lot of different places in the 48 hours before then with a lot of people, there's a lot of close contacts, and those people need to be quarantined. So we really encourage people to limit their close contacts. If you can talk to someone in 5 or 6 minutes rather than 20 or 30, then we encourage you to do that. But if you are going to be in close contact, limit the number of people you're in close contact with. Again, those are our employees, those are our child care workers, our healthcare workers. So you may not be able to limit the time as well as you can, really encouraging people to limit the number of people they're in close contact with.
And I'll just add on to what John said. I think, John, the other thing to add to that is those are the major areas around what we call close contact. Of course, if somebody's kissing or hugging, some of that 15-minute issues might go out the window, and it's more of a direct thing there. So I don't think everybody kisses everybody, but we do hug people at different things. And it's just a cultural norm that we're kind of trying to change around for right now. Just shaking someone's hand, those type of things, decreasing those risks. And if you think about the virus itself, how it normally passes is in droplet form. So everybody's talking about, oh, a virus can get through a mask. And that's true, the small size, but mostly they're taking a ride on a droplet. And that's what gets caught mostly in the mask and why it decreases your risk of spreading it much further. So if people are wearing masks, that helps dramatically. If people are talking more softly and not yelling and screaming, that decreases the distance things will flow. And then if there's good airflow through something, that also decreases the risk of it standing in the air for very long or for longer periods of time and decreasing it. So all those play into it, but the basic overview that John gave, I 100% agree with, and he's completely correct, of course. But just wanted to add on those other little tidbits as you think about it.
Dr. Holzman, thank you. I was sitting in Buffalo Wild Wing the other day enjoying some wings and texting Brad Anderson, telling him how wonderful his staff was in terms of social distancing, the masking, and just the model of doing things right. Brad, I think you're also the chair of the Montana Restaurant Association. I see your hand up. Go ahead.
Thanks, John. Yeah, I think the big common theme on this call is really talking about circling the drain on enforcement and really where we're going to go with that. And what entity is that? Is it going to be, you know, at the state level, DOJ, or all the way down to the county? And I think it's interesting to note what's going on in Missoula. And it was mentioned of some of the, if anybody has a location in that market, as we do, they are going around with the health department doing random checks. I know they came through our store and it's kind of a 3-minute circle and out the door. But out of those rounds that they made, they did close down one bar over there, and I believe they have 2 or 3 cease or warning letters for another future violations that they will be set to close as well. So what we don't want to have happen, and as was mentioned again here today, is that we don't want to be in this binary situation of literally being at an operational level at 75% where we are, or going down to John Felton, the proposing of 25%, which is essentially a close down. The challenge with the 25% in the summertime, one can argue you can sustain, but that's really only if you have the expanded dining hours and also the benefit of a patio. Going into the winter hours, our dining hours get shorter with the darkness, and of course all our patios closed. So we cannot allow ourselves to get in that situation. We are in a closer confined, windows are closed, circulation is limited. So we do not want to go down the path of what's going on in Missoula. So we do need to govern ourselves. And I think it's important that that message gets out there, what is going on in Missoula, so this does not come into our county. And if it does, I think we can all sit here and name a couple in the back of our mind of the bad actors that we've all mentioned here, that they need to come into compliance, and we don't suffer for the masses.
Excellent point. Thank you, Brad. Anybody else who has not posted in the chat room or doesn't have their hand raised? Any other comments? Questions? Please just unmute yourself and feel free to go ahead and ask if you have anything. Okay. All right, well, thanks everyone. I want to end on 2 quick points, I guess, for the media that's still with us. I believe Color 8 Gazette and KTVQ are still on. I just want to, I guess, remind everybody just the impact of tourism in our county as well. Visitors spend about $500 million here every year. And I think there is a perception in our communications and how we are sharing the word that we are closing down. And the fact that 75% occupancy is significant. Our hotels are still open. people can still go to Zoom Montana and participate in some of those activities very carefully. But we received a number of calls today at the chamber asking if it's safe to come to Billings and is anything still open. So those are messages that we really need to flip in terms of letting people know, rather than here are the restrictions, here is what's open, and here are the opportunities we have to welcome our guests and those tourists to our community. So I want to make sure we share that message. Implore everybody to encourage the individual responsibility and how important that is, that if we all choose to do the right thing, we won't be seeing the restrictions to the various industries. And I'm going to end on this email that somebody just sent, or this chat in the box, that just, I wanted to say thank you to all of our public servants and medical professionals. I know your jobs are not easy and the pressure on you is extreme. Thank you for showing up for us every day and for your commitment to our community. Scott Twito, Raph Graybill, Brad, Griffin, Mayor, John Felton, Dr. Holzman, thank you all for joining us today. I appreciate your accessibility. After this call, we will post this to the Chamber's site. Steve, I believe we'll see some things. We'll be able to share this in the Economic Recovery Response Team's homepage as well. So this resource will be available to you. And if you have any questions, if we can help connect you to the right people, didn't get your question answered today, please don't hesitate to send me an email, john@billingschamber.com. john@billingschamber.com, and we'll make sure we get your questions or concerns answered. So until next time, everybody, thank you, stay safe, and let's continue to mask up, work from home when possible, watch our distance, and wash our hands. Thanks, everybody.